We have a look at these. This comes from a paper from the University of Queensland. They've put the term normal, so a non-addicted brain here. And as you can see, the area of the brain is very healthy. There's lots of blood flow. There's good communication, good workings of that part of the brain. They've then gone on to compare this to a cocaine user. And as you can see, the blood flow has been affected to this part of the brain. They've then gone on to compare this to somebody living with obesity. And as you can see visually, that it's quite close to those of that person using cocaine. I like to dig a bit deeper when I look at the research. One, because I am a food addict and I am biased, so I could just take this as gospel. But in research, we are taught to really make sure that we're not just looking for the answers that we want. So I looked into this and made sure that this person that they had scanned who was living with obesity wasn't somebody that was perhaps having to live on corticosteroids. It wasn't necessarily the food that they were eating, it was the medications that they were taking. And when I looked into it, it was a person who had a very high percentage of ultra-processed food diet. They didn't measure food addiction, but they did measure that this person was having about 70% of their foods was coming from ultra-processed foods, sugars and flours.